brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to the show, everyone, and thank you once again for tuning in. If you're just joining us, we are talking about healthy hearts with our good friend, Express Care's Dr. Jitka Lom. So, Doctor, we solicited a variety of questions from our friends on Facebook. A lot of fans posted some questions, so you ready?
Yes.
Okay, first question is a good one. This comes from Belle from Totu, and this is maybe a little bit more of a urban myth. Belle asks, will drinking red wine regularly help prevent a heart attack or heart disease? There is actual medicinal merit to this, I understand.
There is. 1 or 2 glasses of red wine per day is helpful because of the antioxidants, especially resveratrol, which is a hard word to pronounce. Yeah, it's an antioxidant that's present in red wine, and it does have some protective factor. So 1 or 2 glasses is okay.
And red wine specifically,
yeah,
not white wine.
Mm-hmm.
Okay, so good to know. Chanel from Manila asks question number 2, Doctor. Chanel asks, why does a diet high in dairy contribute to heart disease? This is interesting also for people that are lactose intolerant like myself.
Yeah. Actually it doesn't though. That was a myth that was debunked in about 2006 or 7 where further studies were done, and it was discovered that dairy really doesn't have a pro or con effect on your heart. People used to think that maybe since it's an animal product it has high cholesterol and so on, but actually dairy doesn't really make much difference to you.
Okay, so question number 1, you actually supported that. Question number 2 is a myth, so that's interesting. Jason from Dededo, gentleman with an interesting name, says, I am 31 years old and sometimes get sharp chest pains. Should I be worried?
Jason, if you have high blood pressure, you're very obese, or you have a very strong family history of heart disease, then yes, you should be worried. If you're slim, you're healthy, you don't smoke, then probably not. Quite often young people, let's say 35 and under, might have sharp chest pains. They're unrelated to the heart. The way you tell if your heart is impaired is if you're exerting yourself, meaning you're exercising, you're walking upstairs and you're getting chest pain or shortness of breath, pushing the lawnmower, something like that. That's when your heart will speak up and say it's strained.
Okay, so that's good to know. Question number 4 comes to us from Juan from Barragata, and Juan posted on our Facebook wall. Dr. Lom, I've read about omega-3 fish pills. Do you suggest taking these and taking them regularly?
They are healthy. They help modify your cholesterol balance into a healthier balance. So omega-3 fatty acids are healthy. You can also get them in flaxseed oil and other supplements you can buy.
And specifically, what types of fish have higher concentrations of omega-3?
The salmon and mackerel.
Okay, salmon always a good good fish to eat. You've mentioned that several times here, which we appreciate. Okay, down south we go for our next question. This comes from Mike, and Mike is from Inarahan, and asks, heart disease runs in my family. Dr. Lom, what can I do to lessen my chances of getting it? Okay,
well that's an excellent question. So you're not doomed. That's just one risk factor, family history. Then you have smoking, okay, quit. Cholesterol, get it down. If you can't get it down with diet and exercise, then take medication. High blood pressure, make sure it's controlled. Take medication if you need to. And the last one would be diabetes. Either if you have diabetes, control it very well, and better yet, prevent diabetes by leading a healthy lifestyle, keeping your weight down, and eating healthfully.
Okay, good tips. Our last question is from the island's tourism capital. This comes from Sheila from Tuman, and the last question is probably the most obvious. She goes, how will I know, Dr. Lom, if I have heart disease, and are there symptoms I should look out for?
Well, Sheila, about half the time you won't know, so that's why you need to go for regular checkups so your doctor can help you find out if you have any hidden high blood pressure or heart disease. In women particularly, you may not get the crushing chest pain that is classic, everybody knows about. You may just have uncomfortable feelings in your neck, or nausea, or palpitations, or just feeling very tired as a manifestation of your heart disease. So it's really important for you to get a checkup once a year and then do the other lifestyle modification that we talked about.
Okay, well, Dr. Lom, always a pleasure to sit with you on Tuesdays and find out about a variety of medical topics. Good information on the heart tonight. Thank you so much.
Thank you. Take care.
All right. So once again, ladies and gentlemen, do not forget to enter to win the Most Beautiful Lips contest for a free Restylane lip augmentation at the clinic. Did I pronounce that right?
You did.
All right. Win for both of us. Dr. Lom will be back next week to talk about lip health, apropos, fever, blisters, cold sores, etc. Can't wait for that. Send us your questions to healthyliving@kuem.com, or you can post your question on our Facebook page on our website at kuem.com. Now stay with us. There is more Healthy Living when we return up right after these messages.